Good evening, everybody, and thank you so much for joining me again tonight for what I think is going to be a really wonderful, practical, and informative live. I've done lots of lives, obviously, in the past which focus on pregnancy itself, but obviously the newborn period is a time of critical importance as well. And I'm happy to admit that I am probably not the best expert in the world to guide you through the newborn period. And that's why tonight I have called upon someone else to help me guide you through this really, really important time. The newborn period can be really stressful as parents, especially for first-time parents who don't really know what to expect. They don't know what's normal, and I thought it'd be a really great idea for us to shed a little bit of light on this tonight. So tonight I'm delighted to be joined by Dr. Nalu, who is a paediatric doctor who shares my passion for educating new parents, and I'm really thrilled that she can be with us tonight. So I'm going to get her online now, and we'll make a start. Shouldn't be long. I can see her trying to join me. If this doesn't work, I'll try again. It might just be a problem with the connection. I might try again. There we go.
Hello, I'm so sorry.
Not a problem at all. Nalu, how are you?
Good, how are you? Sorry, could you see me trying to see what was going on?
I could. I think it must have been a problem with the connection, but I'm thrilled that you're here with me now. Thank you so much for your time tonight. I'm really, really grateful.
No worries. Thanks so much for having me.
A pleasure. It's lovely to see you again. It's quite funny. A lot of patients always say to me, Scott, you must know exactly what to do with a newborn baby, you know, as an obstetrician. Yeah. And the truth is, I have absolutely no idea whatsoever beyond what I've learnt myself as a parent. So I'm really, really thrilled that I can have an expert here like you tonight to guide us through what is really sort of the next part of pregnancy. You know, once you have the baby, it doesn't all end. It really just begins for a lot of people. And I'm so glad that, oh, it sure does, my friend. I know from experience, but I'm so happy that you're here with me tonight. I've got a lot that I really want to get through. And as we sort of realized earlier this evening, there may be, in fact, too much to cover in one live. And if we don't get through it all, then I'd love to schedule another one in the near future to continue. But why don't we make a start and see how we go, and we'll make a plan from there.
Awesome. Let's do it.
Brilliant, my friend. So I think probably the most common thing that I get asked about, because this is often even an issue before parents leave hospital with their newborn, relates to feeding and weight gain, okay? And it's such a broad topic that I don't even really know where to start with it, but I might let you sort of direct the conversation from here. But essentially, I think what a lot of parents want to know is, how much should my baby be feeding? How do I know if my baby's getting enough? And how does this translate to sort of what it should be doing with its weight over the first, few days, then weeks of life?
Yeah. So it's a massive question. And
it is.
The answer is that every baby is different. And the amount you should be feeding is really as much as you need to make your baby grow. Now, for some babies, that can be, a couple of drops in the first few days. For some babies, it's 50 mils. So I don't like to be too strict on volumes, just because I feel like that puts a lot of pressure on parents. And also, if you're breastfeeding, it's impossible to know.
Absolutely.
Yeah. So the first thing to say is that babies will almost always lose weight in the first couple of days of life. And by 2 weeks, we like to see them come back to their birth weight. There's an arbitrary number of 10%, so they can lose up to 10% of their birth weight. Overseas they have numbers up to 12, 15%. It's just a number, but that's sort of our guide to think, okay, at this point we probably should do something to help with the weight gain.
Yeah.
But
And I like that you
parents,
say it's just a number, because I see so many parents quite distressed on the ward when they've been told by, you know, the midwife or the pediatrician that the baby's lost 11%, and they think they're sort of failing as new parents.
yeah.
And it's not the case at all. But I sort of like that you say it's a bit of an arbitrary number, because I think a lot of parents do put a huge amount of pressure on themselves to make sure they don't reach that 10%. But it just happens sometimes, doesn't it?
Absolutely, it happened to me. I had a
There you
small
go.
bub, and my bub lost more than 10%, and so we started supplement feeding, and
Yep.
it was fine. But
Totally fine.
yeah, so I think that's the first thing to know. I think parents get a little bit stressed when babies lose a lot of weight at the start, and that's completely normal. They just pee out a lot of that excess fluid they're carrying around. They probably don't get as much as they need initially, which is completely normal. So they will lose a bit of weight. By the 2-week mark, we like to see them back at their birth weight. And then roughly, again, as an arbitrary number, about 150 grams a week. Now, you know, some babies will put on 100 grams, some babies will put on 300 grams. It doesn't really matter. What matters the most is the trend in the weight. And so really important for parents to remember that a single weight is really not helpful or as important as us tracking the weight over the first few weeks and months and making sure that the weight is following a certain trajectory. Now oh my God, my cat's in the background.
I like that. We've got another audience member tonight.
Thank you, little thing. I pushed the door open and catch it. Oh, it's embarrassing. So a really good way to keep track of the weight. So I'll chat about feeding in a tick. We'll just finish off on weight, if you don't mind.
Perfect.
A really good way to think about weight is if you've got your little, in Victoria, we've got the green book or your baby book. Or there's the MCH app, which I love, and I use that religiously. So you can just plug in your weights, and it just plots it on the graph. And the main thing you want to see is that the weight's sort of trending upwards along one or two of those lines on the growth chart, which parents may see. Now, some babies are born small and they're meant to be big, so they'll put on truckloads of weight initially. Some babies are born big, say because if mum had some gestational diabetes or other issues, but they're actually meant to be small babies, so they'll sort of slowly find their weight that they're meant to be. So weight can be up and down for various reasons. The main thing is really taking in the bigger picture. And if we see weight sort of dropping below one or two of those lines, then we start thinking about whether we need extra feeds. Is there something else going on? And that's sort of a good time for us to start thinking about if there's anything else. It could be completely normal, but that's a good marker for us if it's dropping one or two lines.
Perfect.
So that's weight. And then with feeding. So feeding, you were asking about, you know, how do we know how much to feed?
Correct.
How much should we be getting in at the start? Really hard. It's really, really tricky, and there's no magic answer.
Yes.
And really the only answer is you need to feed as much as your baby needs to grow.
Right.
So you know, at the first few days of life, if a baby's in hospital and we are feeding them, so down a nasogastric tube for whatever reason, we have calculations based on weight, based on the age, and it's very controlled. And that's just a way that what doctors and nurses in hospital use to keep a baby hydrated and to keep them growing. But as I've realized, even having all that knowledge, coming home and trying to figure out how much to feed a baby is just
so difficult.
It goes out the window. It all goes
out the window.
Because really, if you're breastfeeding, how do you know how much your baby's getting? You don't.
Exactly.
And even if you're bottle feeding, we can't give an exact number of meals in. So I think I would just, trust your gut. So if you feel like your baby is really not satisfied with the feed, really crying a lot, hungry, and satisfied well with some more feed, then they probably need a bit more. But if your bub's having a good feed and then going off to sleep and doing, and otherwise reasonably comfortable and settled, then that's probably enough. The main thing initially to think about is wet nappies. So if your baby's really irritable, and really you feel like they want more to drink, and they're not making much wet nappies, so at least we're talking about 6 a day in the initial phase. Then you might need to think about giving some extra feeds, and whether that be expressing and topping up with a bottle or giving some formula supplements. And no matter how you feed the baby, as long as they're fed and they're putting on weight, I'm happy. I'm so happy I'm still giving formula supplements. You know, whatever we need to do to make sure Bub's gaining weight is the most important thing in the first year of life, really.
Perfect. Excellent. I like the point you make about, you know, not every baby is going to be the same, and the weight gain is going to be different for every baby depending on its growth potential and what it's meant to be. Some babies are always going to be small. My wife and I had a 2.7 kilo baby. I'm small. My wife's 5'0", so we were never going to have a big baby.
Yeah.
So, you know, her growth was never going to be as big as someone who was meant to have a 4.5 kilo baby at birth. And I liken it to pregnancy itself. I always say to couples when they have an ultrasound and we see that the baby might be on the 20th percentile, the first thing I always do is I look at mum and dad. Are they going to have a baby on the 90th percentile? If not, it's going to be completely normal for them. But what I want to see throughout the pregnancy is a baby that maintains that same growth trajectory. So it's following that same curve and not dropping off. And it sounds like you're saying an exactly, you know, identical sort of principle here. And I think it makes a lot of sense to me as well. My wife's correcting me that she's 5'1", not 5'0". We'll measure her later.
That's
excellent. Well, that makes, yes.
Oh, no. I was going to say the other thing to point out, like what you were saying, is it's not a reflection of your feeding or your supply or anything of the actual number that what percentile bub is on. It's just the way that the baby's meant to be. And I think mums put a lot of pressure on themselves to be a certain percentile or a certain weight. And I think it's just remembering that bubs will do their thing, and as long as they're happy and developing, that's fine.
Perfect. Excellent. Great answer. So I think that sort of sums that topic up beautifully. It is not clear. There's not one way to do it. But I think if a parent's ever concerned, and, you know, as you say, to trust their gut and to speak to a maternal child health nurse or their paediatrician if they're worried that their baby isn't growing appropriately, would you say that that's a sort of good guiding principle?
Absolutely. And the other thing I would say is try to keep the scale consistent. So if you're sort of going from maternal child health nurse to GP to emergency, that's fine. But just keep in mind that the scale differences can give you different values. So if you're doing serial visits, try to go back to the maternal child health nurse or try to go back to the GP and keep it consistent.
Excellent. Fantastic. I'll move us on to the next topic, which is something that is a question that I myself asked, you know, of our baby. And that is, when is a baby vomiting too much? When should I be worried? Obviously, lots of babies vomit. But at what point is it something that a parent needs to think more carefully about and raise as an issue with either, you know, their GP or their maternal child health nurse or their paediatrician?
Yeah. And that is a great question. So many parents struggle with vomiting and so many babies vomit.
Yeah.
So my answer to that would be when it's too much, when it's affecting the baby. So you've got these happy chuckers. So reflux is so common. Reflux is when the bottom of the esophagus, the little sphincter there, is quite weak. Most babies babies can't even hold their head up straight, let alone shut their sphincter properly at the end of their esophagus. So reflux is so common. A lot of babies will get a little bit of milk come up from their stomach. A lot of those babies will chuck after a feed or have a little posit or a spill, but they'll be happy, they'll be fine. They'll be putting on weight, they're still interested in feeding, they're not distressed with feeds, they're sort of your happy chuckers. And those babies can literally vomit with every single feed and be completely fine.
Absolutely.
So I don't think it's the actual amount or volume of vomiting. You can have babies who vomit once or twice with the feed, but they're not putting on weight. So that's a bit more of an issue. So I think if the baby is vomiting enough that they're either not putting on weight or have got very slow weight gain based on our graphs, or if the vomiting is really distressing for them. So if mum's feeling like the baby's really distressed and vomiting and irritable, not enjoying the feed, not satisfied with the feed, you know, sometimes you see the back arching and the knees coming up, and sometimes you see blood in the vomit as well if they're vomiting so much. So if they're vomiting plus there's something else going on, that's when I would worry. So so a happy baby who's vomiting but otherwise gaining weight and well generally isn't a problem. I would say at any baby who's vomiting, you should always get checked out at least once. At least once, just to make sure, run the story past someone. Probably a GP is a good place to start. And then if you and your GP are happy that bub's a happy chucker or they've got some reflux but it's not affecting them, fine. If not, then they can think about other things. And if the vomiting continues, so vomiting from reflux sort of should start to settle once they start solids. and once they've got better head control and once their muscle tone's improving. But if the vomiting is still continuing after that, it's another good time to think about getting a review.
Great. And what other, you say if there's anything else going on, what other sort of signs might prompt a review? So what about things like projectile vomiting or, I've heard of babies where the vomiting's quite, impressive and profuse. And is that something to worry about? Is that a separate issue?
Yeah, so projectile vomiting can be various reasons, but the thing we worry about is what we call pyloric stenosis, which is a thickening in the stomach. And that's with those babies, they tend to projectile vomit with every single feed. So usually if there's a problem, it's not going to be something that comes and goes. In general, there's always caveats, obviously, but in general, if you're noticing projectile vomits with every single feed, I would definitely get that checked out. Things like irritability and vomiting always get checked out, especially if there's a fever. Things like urine infections, any sort of infection can present with vomiting in babies, which is why I think any baby who's vomiting should always have at least one check. So fever, any irritability, weight as well. So if they're vomiting and not putting on weight, definitely needs a review. And again, gut instinct. If you're worried, just get the baby seen. You know the parent, you know the baby the best, and you should always get the bug looked at.
Brilliant, excellent. And for babies that have reflux that is distressing them, it's easily treated, isn't it?
Yes and no. So So I've done a lot of chats on reflux recently. It seems to be a hot topic at the moment.
It is.
So just in a nutshell, there are medication that can help the acid levels in the vomit. So it helps the reflux not be as painful. So the contents that's actually coming up isn't as acidic. It doesn't actually stop the reflux. So in fact, what's better to help with reflux than medication is thickening the feeds, because thickener will actually make the milk a bit thicker. It settles a bit more in the stomach and tends to reflux less. So you can definitely speak to your GP, maternal child health nurse about that. There are medications that it's not without risk, it's not without side effects. So we sort of reserve that for the babies who are really irritable, losing weight and having other issues with the reflux.
Got it. Not a problem. Thank you. Sort of moving on from vomiting down to the other end of the gastrointestinal tract, what a lot of parents worry about is what normal poo looks like in a baby. Often babies may have diarrhea, they may be constipated, poo can be all different colours. What's normal and what should prompt, consultation with a healthcare provider? Yeah.
Great question. I see that a lot as well. Baby's poo is so variable. So variable. It can be runny, it can be seedy, it can be mustardy, it can be green, it can be yellow, it can be a huge range, which is why we don't have, someone asked me once, why don't we have a chart of normal baby poo? It's because literally it can be anything. There are a few things that we worry about with baby poo. So, any white poo is probably one of the biggest things that we think about. So poo that's really, really pale, like a chalky white, I'd definitely get that looked at. That can be a sign of liver disease. It can be normal, but it can be a sign of liver disease. So I'd get that looked at. Red poo. So if we've got blood in our poo, we might need to think about things like cow's milk protein allergy or other sort of intolerances. So bloody poo I'd get looked at. And if poo is black, so if there's, in the first few days of life, all babies will pass that meconium, that thick, tarry black poo. But once that's settled, you shouldn't get black poo again. And that can sometimes mean some bleeding further up. So I recently did a chat with midwife Kath, and she said the St Kilda colours is a good way to remember it. So red, white and black, they're probably the only three colours that I would worry about. Any other colour in between, from yellow to green to brown, it could be completely normal.
Perfect. Excellent.
In terms of amounts of poos, I would, where, especially if you're breastfed bubs, they can poo any number of poos from 10 a day to once every 10 days. So normal babies poo a lot, and I know people get quite concerned about bubs doing, 5-6 big poos a day. Completely normal. Saying that, if they go a couple of days without a poo, that's also normal, as long as they're comfortable. As long, again, as long as they're comfortable, if they're still happy, if their tummy's not tense, if they're passing wind, which is a really good thing, then I'm not too worried. If they're really uncomfortable, not pooing, their tummy is tense, and you get a sense that they're just really unhappy, I would definitely get that looked at.
Excellent. And in terms of sort of babies that are just constipated with nothing really problematic going on, they've been seen, they're well, but they're just really constipated. Is there anything that can be done to help that along? Do you recommend things like Coloxal drops? Is that something that you would use, or would you just sort of ride it out and see what happens? What are your tips there?
Yeah, my tips there, look, it depends on the age. It's unusual to see babies who are on exclusively milk-fed babies be constipated. We do see it a bit with the thickeners and the formula-fed bubs. Their poos tend to be a little bit thicker. And in that case, I often would just recommend to ride it out if the baby is comfortable enough.
No worries.
The reason being is, you know, if we can avoid medication in that age group, that's much better if we can.
Ideal.
Once they start solids, so it's a bit outside of the age range we're talking about, but once they start solids, something like Coloxal drops, a bit of Osmolax later on is generally well tolerated. But I wouldn't be going and starting any of that without speaking to someone. Perfect.
Excellent. Fantastic. Thank you. Moving on to the next topic, which is something that I see a lot of in hospitals in the very early days, is jaundice, okay? And a lot of people, I think, are very worried about jaundice, but I think it's very normal for a lot of babies to get jaundice for a variety of reasons that I'm going to ask you to detail now. But essentially for parents who are, you know, coming into hospital, they've just had their baby, what should they be looking out for? When is it a worrying sign? And what are the most common causes of jaundice in the newborn?
Jaundice is super common. So for those who don't know, jaundice is the yellowing of the skin. And that happens from a deposit called bilirubin. So that usually we poo it out and pee it out. The liver sort of breaks down your red cells, poos and pees out all the bilirubin. If it can't do that, which is very common in young babies because they're just little and their bodies are a bit immature, it deposits in the skin. It usually starts from the head down, and often the first place you'll see it is around the eyes. It's hard to see in dark-skinned babies. So for parents who are trying to look for jaundice, a really good tip is to just push the skin for a couple of seconds and then move away. And then when you press away, if it's still yellow, then that could be a sign of jaundice. So jaundice is very common from sort of 48 hours of age up until 2 weeks of age. That's your really typical jaundice that we see in a lot of newborns. If you get jaundice in the first 2 days of life, that's when we generally do a few tests. Because that could be due to mum and baby's blood group not being quite compatible, could be due to underlying illness, so they might have an infection that we don't know about. So generally jaundice that turns up in hospital in the first 2 days we would look into. More often than not, it's fine and it's just your normal stock standard jaundice. After 2 days of age, you may or may not need any tests. And then after 2 weeks of age, if it continues, then we often would do some tests at that stage as well, just to make sure the liver tests and blood tests are all okay. And again, much more often than not, it's completely fine. It's just a physiological jaundice that the bubby will just sort itself out. But occasionally we do pick up on things. So, you know, I don't think we need to go into too much detail because the parents don't need to be diagnosing it, but that's sort of 2 days and 2 weeks are sort of our key times that we think about other causes of jaundice. In terms of what can be done or when is jaundice an issue? So if your bub looks a bit yellow and is otherwise feeding well and peeing, then it's fine. It's probably fine. But then once the jaundice levels start to go up, it actually can make bub quite sleepy. And then it becomes a bit of a vicious cycle. They get tired because they're jaundiced, then they don't feed as well, then they don't pee as much. So they're not peeing out the extra bilirubin, and it just becomes a bit of a vicious cycle. And so once we see that happening, once we see a jaundiced baby who's a bit sleepy and not peeing as much, we need to think about giving some extra hydration to them. And if they're purely breastfed and we think they need a bit of extra fluid, then we can either express and top up or give some formula top-ups. If it's a bottle-fed bub, then often we'll increase their volumes. And if the baby's too sleepy or they're not able to take those volumes and the levels are going up, then we think about giving some extra fluid either down the nose or in a drip. But much more often than not, we can get on top of it with some supplemental feeds.
Excellent. And when do you use, and I know this is, again, it depends on every baby's a little bit different, but when do you use phototherapy? When, you know, I walk into lots of rooms on the postnatal ward and the babies are under lights, when is that something that you would recommend as a paediatrician?
Yeah, so we have very strict sort of guidelines on based on the age of the baby, what gestation they were born, how old they were when the test was done, and we've got graphs that tell us. So literally we just plot it on a graph, and if the graph says this baby needs phototherapy, we start phototherapy. And that's based on a lot of research, and there are heaps of different ways to give the phototherapy. You've got the Billy blanket, you've got the little incubators. I've actually heard of some babies going home with Billy blankets now as well.
Brilliant. Excellent.
But that is the quickest way to break down the Billy ribbon in the skin.
Perfect. Brilliant. And I'm going to move on to another topic now, and this is the one that I probably feel least comfortable with in terms of not knowing anything about it, and it sort of applies to the adult population as well, and that is about rashes. I feel really it's something that unless you sort of see them all the time, it's hard to know a lot about them, but so many babies get rashes. They all look a little bit different. Essentially, when should a parent be worried about a rash? And, you know, what would be the first step in that management? I've got a few specific ones I want to ask you about shortly, but sort of as a general guiding principle, when is a rash something to worry about?
Okay. As a doctor, we see so many rashes, and to be completely honest, a lot of the time we don't actually know what the rash is.
Agreed.
I'm just going to be honest, because so many things can cause rashes, but we know what to look out for that's worrying, and we know what's common. So in terms of things that, so basically what I'm trying to say is babies get lots of weird rashes. I mean, half the time my kid has a rash, I'm just like, what on earth is this?
I know. I always say to my wife, what do you think this is? She's like, you're the doctor. But I have no idea.
Like, if it goes away, it can't be that bad.
Exactly.
So just know that baby skin is weird. Newborn baby skin is really weird. They get all sorts of acne and dry skin and really weird rashes. When I would worry, or at least seek some extra help, would be if I'm worried that the rash is infected. So if it's looking really red and angry, and or yellow and oozy or smelly. So any sign of infection, I would definitely get that looked at. Just sorry, my cat's just jumping around. So I would definitely get that looked at, just because Bub might need some topical creams, or maybe something oral if they're really unwell with it. And then secondly, if they are unwell with a rash. So if they've got a rash and you think they're really irritable, if, you know, little babies will squirm a lot if the rash is really itchy, because they obviously can't itch it themselves. So if they're really squirmy, irritable, and they've got a rash, I'll definitely get that looked at. The most probably concerning rash that we hardly ever see now in bubs is the non-blanching rash. So blanching means when you push it and then take your finger off, the rash disappears. If you do that and it doesn't disappear, I'd definitely get that looked at. It's not very common in little babies. It's a bit more common in older kids. But if you do, and there are other things that cause that, so I wouldn't panic straight away. But if you push on a rash and it's got that sort of dark red look to it and it doesn't disappear, I would definitely get that looked at.
And what could that represent?
That could represent meningococcal.
Right.
Which is a very concerning bacterial infection. We don't see it as much now, and now we've got amazing immunizations around for a lot of the meningococcals. So
absolutely,
we definitely don't see it as much, but it's just one to be aware of.
Definitely. I remember that was sort of the one take-home message that I was always taught at uni many, many years ago when I did my paediatric term, but it's something that I certainly haven't forgotten. But as you say, it's not particularly common at all, is it?
Well, no, thanks to the vaccines. Yeah.
Exactly. Perfect. So a few rashes, if you don't mind me going through, because these are the ones that sort of I seem to get asked about the most. And as I say, don't really know what to say. So the first one is cradle cap. So a lot of babies get this cradle cap rash. What should parents be doing about that?
Yeah. So cradle cap, for those who don't know, is that really thick yellow crustiness on the scalp. You can sometimes get it on the eyebrows as well. That's an overgrowth of the oil glands. Really common. And it can look really manky. And don't be worried that you've done anything wrong, because you haven't. It's just the way it is. Some babies get this. Treating cradle cap is so satisfying. I love it. Because it's like pretty much foolproof if you can really get on top of it straight away. So the Royal Children's Hospital have a really good cradle cap handout that I absolutely love. But essentially, in a nutshell, moisturize, really massaging the moisturizer into the scalp, ideally the night before. And then when you do the bath the next day, you want a really nice fine tooth comb and just gently lift off all of the crusts. And I find that quite satisfying. I think that's a bit weird. But when my baby had cradle cap, we got all of that off, and then literally within 2 days of doing that, it was just clean. And then if you notice it coming back, you just do it again. Just pop a bit of moisturizer on the next day.
Great.
Give it a little brush. You can also use some anti-dandruff shampoo, just a small amount in that area. It can be a little bit irritating though of the skin. So, but honestly, try the moisturizer and the scraping off for a couple of days, and you'll notice a huge difference. Perfect.
The next rash that I want to ask you about is something that, you know, I think a lot of parents don't like the look of, but I believe it's completely, you know, benign and not sinister at all. And that's sort of that newborn acne that a lot of babies get. Is there anything that parents can do about it? Do they need to be doing anything about it?
No, unfortunately, there's not much you can do about it. It looks nasty, and it can look so horrible, and it comes and goes and can last days and days, and it ruins all your photos. I get it. My mum had that too, but there's not much that you can do about it. No. I would just make sure the area's clean. So just make sure that you're sort of patting it down with warm water. You don't want to be putting too much creams and things on it, because you just want it to air out. Sometimes if it's in really tricky spots like creases, especially the neck creases and the armpit creases, if it's getting really moist in there, that can make it get infected. So I just pop a little bit of pseudo cream or a bit of thick barrier cream if it's in the creases, just to help dry it out a little bit.
Excellent. And the last rash excellent. And the last rash I'm going to ask you about is nappy rash. What should parents be doing about nappy rash?
So nappy rash in general is really common. Comes from, often it's from sitting in their poo, which we can't avoid. You're never ever going to be able to change a nappy as soon as they poo every single time.
Exactly. And I think if you go too quickly, you're going to get pooed on.
Absolutely. So zero pressure to change nappies straight away. But, you know, the sooner you can get to a nappy, the better, because the poo has acid in it, and it can just, you know, it can irritate the skin. You want to make sure you're cleaning the bum really well. Particularly in the early stages, just cotton ball and water is fine to make sure that you're getting all the poo off.
Great.
And then a really good barrier cream, particularly something with zinc. So I shouldn't be mentioning brands, but Pseudo Cream is it is the one that I would just, if you have to buy one cream, I would get it.
Got so much here if anyone needs.
And you slop it on, and a good, thick, generous amount. Slop it on with every nappy change if you've got some of that red rawness. Also, just airing out the bum is really good for the skin. So if you can manage a little, like a bluey type thing on the floor, and just let bub lie down and just air out the bum, that's really good for the bum as well. The only other thing I would say is if you know that you may not be able to change a nappy for a while, so say you're going to jump in the car and drive for an hour, or you're going out, then a good barrier cream can help, just in case they poo, just to help protect the skin.
Brilliant. Excellent. I have to say, I'm loving the commentary tonight. It's keeping me very entertained while I'm listening to you as well, which is good. Now, Lou, the next thing I want to ask you about is something very practical. A lot of parents want to know, how can I actually accurately measure my baby's temperature? You know, sometimes you call the maternal child health nurse and they say, have you taken the baby's temperature? What is it? What is the right way for parents to be taking their baby's temperature?
Yeah, I think if we're talking about newborns, this is not for parents, but the most accurate way to check is in the bum. And so you may notice if you're going to hospital, we'll request to do a rectal temperature, because that's the most accurate. Do not recommend parents doing that at home, but just so parents don't get a shock when they're going to hospital. I would say at home, there are so many thermometers, but I think in this age group, in the less than 3 month age group, probably the armpit's the best one. These forehead ones are really expensive, but I've seen a lot of inaccuracy in this age group. And I think we're going to talk about fever, but in this young age group, you don't want to be a degree off when you're checking a temperature. You want it to be accurate. So I would just go your standard thermometers that go under the arm. That's probably the easy. I wouldn't bother with all these fancy ear and forehead ones.
Brilliant. And what is a normal temperature in a baby sort of 0 to 3 months of age?
Yeah, less than 38. So normal temperature is sort of 36.2 to 37.5, but we wouldn't call anything a fever until it's 38 and above.
Great, excellent. Perfect. So coming on to, or coming into our next question, which is something you mentioned just before, but what should a parent do if a baby has a fever? What's sort of the your general rules that that parents can follow?
Yeah. So first thing I would say is I wouldn't be routinely checking your baby's temperature.
Good.
No one needs to, you don't need to just check for no good reason at home.
Yeah.
If your baby's feeling really hot, or if they're really irritable and they're upset, or something just doesn't seem right, I think that's probably a good time to check a temperature. Great. If your baby's less than 1 month old, even if they're well in themselves or seem pretty well and you've done a temperature and their temperature's 38 or above, I would definitely go and have them seen, probably head to an emergency department, only because the bub will probably need some tests. You could very easily go to a GP to have a review, that's fine, but bub will probably need some blood tests and a urine test and a few other things if they're less than 1 month with a fever. From 1 month,
that makes a lot of sense.
Yeah, and the reason for that is at that age group, their immune systems are so immature that they can have quite a severe infection and only have a fever, or you know, still look okay, but then they can get sick quite quickly. And if you present to an emergency department with a less than 1 month old with a fever, you'll be seen fairly soon. 1 month to 3 months is not as urgent, but I wouldn't be sitting on it at home and just sort of umming and ahhing. If you're worried, go and get them seen. And after 3 months, anything like a virus and your really common causes of fever are usually there. So usually they'll have other symptoms instead of anything. But, you know, always if you're worried if your child has a fever, go and have them seen. But if they're less than 1 month, you definitely have to get them seen.
Excellent.
And if they've got a fever and you're worried, like if there are any symptoms that you're worried about, always get them looked at. If they're not drinking, if they're not peeing is a really good marker of illness or wellness. You know, at least half of their normal wet nappies is a really good indicator that bub's hydrated and generally well. If they're very sleepy or very irritable, so if they're not sleeping at all because they're so irritable, or they're really sleepy with a fever, I would definitely get them looked at.
Excellent. And in a young baby sort of up to 3 months of age, what would be the most common causes of fever?
Don't quote me on this, but I'd say urine infections probably up there. Urine infections are really common, and that can present with just a fever, or usually fever and vomiting, or other infections, either infections that they've got from mum or from older siblings. They're probably your most common causes of fever in that age group.
Definitely. And I think, you know, you make a good point to say in that very young age group, symptoms can be very, very non-specific. You know, in an adult, if you've got a urinary tract infection, you're more likely to have burning and stinging and foul-smelling urine before you get to the point of fever, whereas in babies, it's very different. So you can't look out for those same sort of focal symptoms that you get in an adult. And babies often just present unwell, don't they? Yeah.
Absolutely. That's what makes it so tricky. And that less than 1 month age group, they're the bubs that they can go from urine infection to meningitis reasonably quickly. Which is why we say you should be seen straight away.
Perfect. Thanks for that advice. I'll move on to the next question now. A lot of parents sort of have a high degree of anxiety and anticipation about baby's first immunisation. So for parents that have never done it before, what can they expect when they show up to their you know, GP or paediatrician for their first set of immunisations? Yeah.
So that's understandably really stressful because you've got this tiny little baby and you're about to go and give it. It's pretty awful. And, you know, I've done it forever, and still taking my bub was pretty sad.
Couldn't agree with you more.
But look, I think the main thing to know is, so usually, depending on where you're watching, but you know, usually we've got the oral rotavirus, so there'll be an oral vaccine, and there'll be an injection. It's usually in the thigh, and generally the people who do it, so whether you do it at the community centre or with the GP or an immunisation clinic, they're usually really, really experienced. They do baby immunisations all the time, so you can trust that the bubs will be in good hands. I tend to have, I usually just have a bottle of paracetamol just make sure I've got some at home, just because you can expect bub to be a bit off for 1 or 2 days, which can be completely normal. So if you think about it, they've been given this medication and their body's mounting this immune response. It's uncomfortable for them. So it's completely normal for them to be a bit more clingy, a bit more sooky, a bit off their feeds, just a bit off for the next 48 hours. Some babies feel a bit warmer than usual, but they shouldn't get a temperature. So if they still get a temperature above 38, I'd get them looked at, just because it could just be a coincidence and they might have something else going on. But if they feel a bit warm and then the temperature is not too bad, then I wouldn't be too concerned. But I would just have some paracetamol ready to go just in case Bubby's quite irritable, because that can just help. That can just help make them comfortable. In terms of practicality at the actual appointment, I was present for the appointment and I was just sort of there as a comforter, and I was ready to grab Bub straight after. I had a bottle ready to go and just popped it straight in her mouth. And by the time we got back to the car, she forgot that it even happened. So I just, have the boob ready, have a bottle ready to go, and just comfort Bub and be there, and, just hold your breath and be strong, because it's hard to see.
Definitely. I think it's one of the, hardest but most important things as a new parent was going for those first vaccinations. My wife and I went together for moral support for one another, I think. But it was probably harder for us than it was for our little one. But no, I agree with you. I think being prepared afterwards is a really good plan.
Yeah, and just make sure that you don't plan anything too important in the next 2 days, just in case you need to be at home and just have a good cuddle with Bub.
Perfect. Great advice. Next question I'm going to ask you is about sleeping positions. So obviously this is something that I think parents should be very much educated on and aware of, because, there's a lot of awareness about reducing the risk of things like SIDS. And I think safe sleeping for babies is something that, parents should be taught about before they give birth. So for people who are watching tonight who are pregnant, or for, patients of mine that have just had babies and are watching, what's the right way to have your baby sleeping?
Yeah, I'm so glad we're talking about this, because babies still die from unsafe sleeping. So I think it's really important to talk about. So for bubs at this age group, so babies who can't roll comfortably, sleeping on their back is the only way they should really be sleeping. So you always want to have bubs lying on their back. With newborns, they really like to be swaddled. And that's completely fine, and they often will sleep better if they're swaddled. So swaddling is completely fine, but you don't want it to be too loose that it can come undone. So you just want to be really careful with loose blankets. And the tricky thing for those who are pregnant at the moment, if you go on Pinterest or Instagram or any of these websites and see all these beautiful nurseries, they've all got beautiful blankets and pillows, cushions, and toys and cushions and throws. Nothing. You don't want anything in the cot or the bassinet. And it doesn't make for a pretty picture, but it is so much safer for your baby than having loose bedding around. So you want to, and you've probably been given all of these beautiful things. Just use them when the baby's not in there for a nice picture, and then move them out. So you want your baby sleeping in a cot or bassinet with absolutely no bedding, just their swaddle or a little sleeping bag even. My bub after week 3 hated to have her arms in, so we just had the little Love to Dream arms out sleeping bag. But sleeping bags are great because there's just no loose bedding around. And then as soon as your baby looks like they're starting to roll, then you want to have their arms out, because if they're still swaddled and rolling, then they can't roll back if they turn onto their tummy. Now there's no way that you can sit there and watch your baby sleep and make sure they don't roll onto their tummy. But generally in those first few months, they're not doing much rolling anyway. So the way you put them down in bed is generally how they'd stay for the night. So if you can keep them on their back, keep them in a snug wrap that's snug enough to not come loose, but not too tight that it's going to disrupt their hip development. And then that's all you need really, just lying on the back with no loose bedding. You don't want things like beanies, mitts, anything that can come off and cover their face as well.
Great advice. Absolutely brilliant advice. And, you know, it's obviously a difficult topic to talk about. You know, I think a lot of new parents are very fearful of this sort of scenario, but I think it's an important one to discuss to reduce the risk of, you know, awful complications that can occur if babies don't sleep properly.
Yeah, I might just say the Red Nose website is incredible.
Brilliant.
Good, yeah.
Back there, yeah. I couldn't hear you for a second. I got you now.
No worries. Yeah, I was just saying the Red Nose website, amazing resources for parents. I still jump on there every now and then. I wanted to know if cot bumpers were safe, and I just quickly jumped on there and had a quick look, and they're not safe. So yeah, I would all new parents or anyone who's pregnant at the moment, just jump on there and have a quick read.
Brilliant. Excellent. Now, the next question is just one that I get asked, and I think it's more for interest than it is for actual sort of medical knowledge or anything. But a lot of parents want to know when their baby's born, what can the baby see and what can the baby hear? They, you know, are they aware of the voices that they've been hearing during the pregnancy in utero? But what actually, in terms of, you know, vision and hearing, does a baby have capacity for?
Yeah, so generally we think at the start that they've got sort of more black and white vision. They don't really develop their full colour vision till about 5 months of age, which is why those black and white contrast books and stuff are amazing. Babies love them. And they can see more solid shapes, so they can't see as much detail until a couple of months of age. And you'll notice that when your baby can start to see more detail, they'll really start to focus on things, whereas initially they're a bit glassy. They're kind of looking through you at the start, and then you'll notice a few weeks on they'll start looking at you. Then after about 6 weeks or so, they might respond to a smile, so that means they can see your smile. So yeah, early on it's not a huge deal, and it's contrasting and big shapes is much easier for them to see. In terms of sounds, they're generally pretty good at picking up loud sounds. If you think about it, they've been in your stomach, they can, and you know, you might know, I know that when my husband's alarm went off once when I was pregnant, Bub sort of woke up and did a little jerk and fluttered around. So you'll know that Bubs, they respond well to loud sounds. Soft sounds are obviously going to be a bit harder for them initially. And then you will notice when they can start responding to voices. So sort of in the first month or two of life, they'll start to respond to your voice. You'll notice them turn to sound. You know, if you jiggle some keys, you'll notice them turn to sound.
Yes.
All babies in Victoria will get a hearing test before they go home from hospital.
I was just going to ask you about that.
Yeah, so they'll get their hearing test before they go home from hospital. And then after that, it's only if there's an issue that they'll get more hearing tests. Things that you would look out for are sort of, you know, by the 1 to 2 month mark, if they're not turning to sound, if they're not startling to loud noises. So that, you know, if there's a massive jaw bang, they should do a little jump. Particularly early on, and with vision, if you don't think they're looking at you, focusing on you, if they're not sort of responding to your smiles, then you might need to think about getting the vision checked.
Not a problem at all. I have 2 more questions for you tonight, and then I'm going to let you go. So the next one is one that's been asked by a couple of people tonight who are watching, and it relates to sort of babies who are very unsettled from sort of gas, wind, colic in the early days. What can be done about this?
Not much is my short answer. You know, babies are in utero, they're getting the same thing go through their system. You know, they're breathing in they're swallowing the amniotic fluid, it's coming out. They're in this nice warm environment that's always 37 degrees or whatever it is. And then suddenly they're out and they're exposed to the elements. They're getting milk, and depending on what mum's eating, the milk is going to be different. They're getting formula, they've got, you know, they have to suddenly digest, they're doing poo, there's stuff coming out of their anus, all these things are going on, and it's uncomfortable for them because they're so little and they're so sensitive, and so pretty much anything that goes on for them is going to freak them out at the start. So I guess what I'm trying to say is that it's really normal that babies early on are upset, irritable, squirm, go red in the face, make funny faces, do all sorts of weird things. It's all part of normal. And obviously there's a spectrum. There are babies who are really irritable all the time and may need to have a review, and babies who aren't too stressed about anything, and that's I wish I had one of those. But I guess, you know, I think mums and parents just need to be aware that there is an element of babies just being upset just because, and just knowing that it's not anything you've done wrong. It's not anything that's wrong with the baby. It's just the way it is. And you know, things like wind, and I think there were a few questions before on wind and burping.
Yes.
Wind can be uncomfortable. I mean, even if we have a bit of wind, it's a bit uncomfortable. So it can be uncomfortable. And I know we feel like, especially when you're tired and stressed and you just want the baby to be settled, I know we feel like we want to do something. There's not much that we can do. And there's a lot of over-the-counter stuff, and there are heaps of blogs and all this thing about all these things that may or may not work. The reality is a lot of it hasn't been studied, or if it has been studied, it hasn't been shown to make any actual difference.
Yes.
You know, most of the things over the counter aren't harmful, and if you want to give it a go and it works, that's great. But you know, we don't necessarily condone it because we don't really know if it makes any difference. Sure. Much more often than not, it's just time. And there's not much that you can do. And I know people get really hung up, particularly on the whole burping thing.
Yes.
I don't know if you want me to go into burping. I think someone asked about it before, but a lot of people get very stressed about burping, and they might spend 2 hours sitting there trying to pat their baby on the back, trying to get them to burp. My general thing is, if they're going to burp, they'll burp. I don't spend more than 30 seconds to a minute.
Great. Excellent.
If they burp, they burp. If they don't, it'll come out the other end. They'll be fine. We don't burp after every time we feed. They'll be fine.
Very practical tip, my friend.
And then in terms of the colic, look, like I said, it's all part of the normal spectrum. We know colic and just that sort of crying, and particularly that evening crying, witching hour phase, gets worse around the 6-week mark and is there till about 3 months.
Yes.
And
all too familiar.
Settle around the 3-month mark. Obviously, if you're worried, if you're really, you know, as a parent, if you're really miserable and not sleeping, I would definitely seek some advice. But just know that it usually gets better, and it's a lot of it is part of normal baby behavior.
Awesome. Fantastic. And I've got one more question for you tonight, which is just a really sort of pragmatic tip for new parents. If parents were to sort of create a little medication box or sort of home first aid kit for babies, what should be in it? Sort of a thermometer, Panadol, what would you have in a kit? You know, what did you have when you had your little one? What was at home ready to go just in case?
Yeah, well, that's a great question. So yes, I had a thermometer. I just bought a cheap, like the Vicks $10 thermometer. Pseudo cream. I have buckets of pseudo cream. Love it.
So do we.
I also have nappy goo, the Royal Children's nappy goo. It doesn't have the zinc in it, so it's not as good if there is a nappy rash. But I like that for a preventative, for a barrier cream. So like if we're going for a drive or going out and I can't change the nappy straight away, I just pop a bit of that on.
Perfect.
I have QV cream. I love the QV cream pump pack. I put that on Bub every morning, every night, regardless. And my baby's got a bit of eczema, but I think if it wasn't for that, the eczema would be so much worse. So I love the QV cream. Baby Panadol. We can't really say brand names, but whatever.
Fine.
baby Panadol. I haven't used it yet, but I've got it with me. Just, you know, immunizations, teething, anything, miracle drug. Love it. What else? For a bit older age group, but I just have a bit of Zyrtec at home as well, just in case once I started solids, just in case there was a bit of an allergic reaction. I made sure I had the Zyrtec around. They're probably my main things, really. And bath oil, if you want to get something. Bath oil is fantastic for baby skin.
Perfect. Brilliant, brilliant, brilliant. Well, I think that has been an incredibly informative sort of session tonight, and I have learnt so much from it, and it certainly makes me feel a little bit more confident moving into our second baby who'll be arriving next year. But thank you very much. But what are your sort of, have you got any recommendations? You've mentioned the Red Nose website, the Royal Children's. Any other great sort of websites that people can access for very useful tips?
Yes, the Raising Children's Network. Gold, absolute gold. I use that for everything, and I refer everyone there. So
brilliant.
Yeah, Raising Children's. And just for later on, when you're starting solids, nip allergies in the bub. Preventallergies.org.au is amazing. Excellent.
Fantastic. And personally, can people head over to your Instagram page or website for useful sort of tips and other lives that you've done with other people?
Yeah, absolutely. Just jump onto my
Awesome.
Instagram. I've done a whole bunch of lives about quite a few of these topics that we've discussed, and they're all on my IGTV.
Brilliant. Excellent. Well, I will certainly save this and post it to my Instagram so people can access your page as well. But thank you so much again for your time tonight. I am really, really grateful. Really an incredibly useful life for all, I think, pregnant women and new parents. So incredibly grateful for your time. I hope you have a nice week ahead, and I look forward to catching up with you again soon.
Thank you. Thanks to everyone who tuned in, and no pressure. We have to
be kind to ourselves. Thank you so much. See you later. Bye.